Okay, so if you're a female in your 40s and you have concerns that you're getting facial hair, but yet losing hair on your head, you've got to get your testosterone levels checked and the full male hormone panel.
Introducing the Perimenopause Podcast, a show dedicated to unraveling the mysteries of achieving optimal health naturally as you transition into perimenopause and menopause. Get ready to join your host, Dr. Seth Yates, an experienced naturopathic doctor, acupuncturist, and kinesiologist, as he shares his wealth of knowledge acquired from over 40,000 patient visits and 15 years in working with perimenopausal females. Welcome to the Perimenopause Podcast.
Hey, this is Doc Yates. Welcome to perimenopause.com. And today we're talking about signs and symptoms of excess testosterone and other androgens in females, and then what you can do to correct this. So this is not uncommon that you can see into perimenopause and into menopause, and even earlier, especially in cases of what we call, you might have heard of the term PCOS. So in any one of these situations, it's not uncommon to start seeing signs and symptoms of excess testosterone. So let's dive into that. And a classic example, I can think of a case where I had a female come in and she was getting a lot of hair growing on her chin, but yet she was getting her hair, her actual head hair, especially kind of like along the classic male pattern loss of like what we would call the widow's peak. She was losing hair there. She did have very irregular cycles. She did have a history of PCOS and an oily skin, and all of with more increased acne as well. So these were her chief concerns, which was like a textbook situation of excess testosterone in a female, excess androgen. So what we want to do is, one, you get those levels checked, and you don't want to check just your testosterone levels. You also want to check, so you want to check testosterone. You want to still check your female hormones, estrogen, progesterone. There's something called, make sure you write this down, DHT. You need to check DHT. This is something that when this gets elevated, the signs and symptoms of excess testosterone, especially the hair changes, will be much worse. Now, from a medical standpoint, to deal with this, they usually just give you drugs. And very commonly, they will give you metformin, which is a diabetes drug, and sometimes they'll give you something called finasteride, which is a prostate drug. Personally, I'd rather dive right into treating the root cause of this. Number one, you need to switch to a low-carb, low-sugar diet. Anything that's higher sugars will spike your insulin and will cause your body to dump more of the bound-up testosterone into your bloodstream. So think of this as excess sugar means excess testosterone. Number two, we do like to use herbal therapies, and the herbal therapies in a case like this, they would have multiple functions. One, we want to stop the excess conversion to testosterone, and then the excess conversion of this testosterone to DHT, and we want to use herbs that have a supportive therapy, say for hair support, etc. So peony, white peony is always on the list because it's good for hair, it's good for excess testosterone. Nettle helps with this, prevent this conversion of DHT to DHT. And it's also really good for hair support. So anytime you can use herbs that have like a 2-in-1 affect, that's the way you want to pick. So nettle's on the list. Saw palmetto also can help block this conversion of excess testosterone to DHT, causing the effects with your hair. I always use trace amounts of iodine, especially in the area we are. Iodine is very common to be deficient, and when that is off, it can affect your progesterone levels. And when progesterone is off, if progesterone is lower, then you will have increased production of DHT, which means that point number 4 is that you have to balance progesterone. If the progesterone is really low and you need to actually use topical progesterone that kind of alters throughout your cycle, then that's an easy way to do it. Sometimes if it's just slightly low, you can add additional herbs like Vitex or Diascorea to help with the progesterone aspect of things. Now, after you're getting the hormones and everything balanced, at that point, it makes sense to do something like laser hair removal, because balancing the hormones is not going to make any of this chin hair and stuff just fall out on its own, but what it will help prevent these the hair from growing back. So you want to balance the hormones first. You can use laser hair removal to then get the hair removed, and then when the hormones are balanced, it won't be coming back so prevalent. So those are 5 quick points that you can do if you're struggling with signs and symptoms of excess testosterone as a female, especially in perimenopause. So I hope this was helpful. This is Doc Yates signing off.
Thank you for tuning in to the Perimenopause podcast. Don't forget to hit the subscribe button and visit perimenopause.com for more valuable information on how you can thrive during your transition through perimenopause. Join our community of like-minded women who are dedicated to achieving optimal health naturally, and stay up to date with the latest tips, tricks, and advice from Dr. Seth Yates. And we'll catch you on the next episode of the Perimenopause podcast.